They were charged with conspiring to trigger the First World War and faced systematic discrimination and abuse from their neighbors and government. After years of being isolated from society and crammed into unsanitary ghettos, they were now uniformly rounded up and shot into pits. Such was the suffering of the Jews, Gypsies, Slavic peoples, and all those considered racially inferior by Hitler. With millions of human lives now under their control in these camps, German doctors, scientists, and pharmaceutical companies chose to seize this unparalleled chance. This was done in the name of advancing medical research and supporting Hitler's unfounded theories about racial science. This segment is the second part of the account of the immoral doctors of the Third Reich. After stepping off the train, they were severely dehydrated to the extent of hallucinating, starving, and exhausted from standing for many days inside a packed cattle car. The air around them was filled with the unbearable odor of their own urine and feces, mixed with the stench of those who had perished during the trip. As the train approached the camp, signs along the tracks informed the new arrivals of their destination. Concentration camps. The Germans commonly referred to these places informally as KZ. If they had been part of the initial convoys, their journey would likely have concluded in a mass grave. Yet the Nazis had faced an issue: the smell from tens of thousands of decomposing bodies. Consequently, the Nazis adopted the solution of cremating the bodies, and they built crematoriums. The air around the deportees now carried a different foul smell. Some optimistic newcomers, smelling burning flesh, commented to each other that it could be a meal of cooked chicken awaiting them. Their initial meeting was frequently with the camp's head doctor. For people arriving at Auschwitz after May 1943, the greeting came from the young Schutzstaffel Obersturmführer, senior storm leader, Dr. Josef Mengele. With an indifferent wave of his hand, he and other uniformed physicians assigned the newcomers to one of two outcomes. Fit men and women were directed to the right. Certain individuals were destined for a slower death via forced labor and starvation. Others seemed sufficiently noteworthy to be used as human test subjects. The left side was for women, children, the elderly, the disabled, and the sick. They received deceptive promises of a shower, hot food, housing, and being reunited with their families. The idea of being parted from their parents filled them with panic. Young women assigned to the right column would beg to accompany their elderly parents and grandparents into the left column. When the Nazis allowed them to remain with their families, they tearfully thanked them. Certain survivors describe enduring lifelong sorrow from this instant, like the story of an older sister. She urged her younger brother to join the left column so he could stay with their mother. She would never again see either her brother or mother. Parents chosen for the right column frequently objected to being split from their children. Numerous fathers and mothers desperately held on to their small children. As the Nazi guards and capos forcibly tore them apart, they yelled reassurances that they would be reunited. Despite a relentless rain of painful strikes to the face and head from the capos' rubber truncheons, terrified parents refused to loosen their hold on their children. Survivor testimonies describe their utter horror as they witnessed small children having their limbs ripped from their bodies during the struggle. Afterward, the left column was marched a brief distance, about 300 yards across the camp, into the courtyard of a red brick structure. Next, beneath a sign that calmly read, "Baths and Disinfecting Room," they descended a concrete staircase into a spacious chamber equipped with numbered hooks and benches. Dr. Miklos Niesli, a camp prisoner, sadly remembered that many among the people he observed went down those steps almost cheerfully. In that room, they were forced to strip. Those women and young girls who showed modesty and resisted were forcibly undressed. They were told to neatly arrange their garments and keep their footwear orderly so they could retrieve them afterwards. Naturally, that was a falsehood. Those last directives were meant solely to ease the Sonderkommando's tasks. The garments and any leftover possessions were gathered, auctioned to support the Nazi war machine, or sent to German towns requiring provisions. The Nazis merely wished to avoid confusion with footwear sizes. The newcomers were then driven into an extended chamber featuring wire-wrapped metal posts positioned down the middle. After that, the doors were secured and the lights turned out. Ironically, a medical vehicle displaying the International Red Cross emblem soon appeared on the roadway above. Men in uniforms, donning masks and transporting containers, would step out of the vehicle. They approached the tiny concrete tubes protruding from the earth above the shower area, quickly poured a powdery material into the aperture, then closed it and listened until the cries ceased. The children and frailer adults were the initial victims. They were stamped and squeezed to death by their own relatives and companions. Their desperate attempts to endure and flee the ascending poisonous fog were useless. Dr. Neasley records that he was there to see one of these frequent events. To ensure the operation was complete, the two executioners of the gas chamber held off for an additional 5 minutes. Subsequently, they lit cigarettes and departed in their vehicle. They had just murdered 3,000 innocent people. In the meantime, the right column remained stationary. Dr. Neasley describes his experience, noting that Dr. Mengele commanded all physicians to come forward. He then walked up to the fresh assembly, which consisted of roughly 50 doctors. He inquired about individuals who had attended a German university, possessed some understanding of pathology, and had worked in forensic medicine. He directed them to move ahead and exercise extreme caution. Mengele added, "You must be up to the challenge, because if you are not," his threatening motion made his intention unmistakably clear. Dr. Neasley, a skilled expert in forensic and anatomical pathology, advanced after being interrogated by Mengele. He was subsequently appointed to the camp's Sonderkommando unit, and the tale of this group alone warrants a separate narration. For the purpose of this narrative, it should be recognized that they, similarly to the capos, were inmates of the camp. The capos, serving as prisoner police, were typically hardened convicts selected due to their readiness to inflict violence. Provided with substantially improved housing and meals, they received secondary supervisory roles over other prisoners. They loyally served the SS despite being captives themselves. Their duties included punishing and even executing those who misbehaved, akin to these individuals, in return for their own survival and access to superior circumstances. The Sonderkommando carried out the bulk of the grim tasks in the crematoria and laboratories, while the Nazi SS only issued commands. Auschwitz survivor and writer Primo Levi describes the Nazi ideology behind employing prisoners in this manner. Assigning them to minor duties is insufficient. The most effective method to bind them is to load them with guilt. Drench them in blood, entangle them as deeply as possible. In this way, they will forge a connection of complicity with their perpetrators, and they will be incapable of retreating. On a regular schedule every 4 months, the Sonderkommando were abruptly annihilated. They were put to death to ensure no individual inmate saw more than the Nazis deemed permissible. A fresh contingent from an incoming transport would be chosen to take their place and to incinerate and eliminate the remains of those who came before. Dr. Neasley was a rare prisoner who, as an eyewitness, survived after entering the crematoria gates. By the time Dr. Neasley arrived, Auschwitz consisted of several adjoining or near camps, with a growing influx of deportees coming by rail. At Auschwitz II, known as Birkenau, a 3-way railway track and extra crematoria were built. These new facilities were meant to accelerate the process of choosing and gassing incoming deportees. Birkenau functioned as the main death camp within Auschwitz. It also acted as a site for experiments, with the adjacent crematoria used to get rid of the victims' corpses. Very few individuals were ever able to recount the horrors they saw in these camps. Most were killed soon after they arrived. Consequently, it's obvious that these deeply terrifying accounts have mainly been shared by the only ones capable of doing so: those who survived. The goals of human experimentation differed across the various concentration camps in Germany and Nazi-occupied territories. Partly, German drug firms exploited the unrestricted availability of live human subjects to try out various new vaccines and medicines. A greater number of experiments had military purposes, seeking to advance scientific understanding. Specifically, they aimed at treating and preventing wounds, infections, diseases, and later deaths of German soldiers in combat. Moreover, these experiments were carried out based on the Nazi idea of demonstrating the validity of their racial theories. Their false scientific conviction in Aryan racial supremacy drove these ideologies. Around 200 Nazi doctors who committed these offenses had total liberty to operate. They operated with no adherence to fundamental medical ethics and no concern for their patients' well-being. Their victims, in fact, almost all test subjects experienced immense agony, mutilation, and unbearable pain. The experiments were frequently intentionally planned to result in the death of the subjects. IG Farben Industry, established in 1925, grew into a corporate conglomerate. It went on to dominate Germany's chemical manufacturing and acquire all of the nation's key pharmaceutical firms. In a twisted union of scientific inquiry and state-funded annihilation, Nazi doctors got financial support from top medical establishments and universities. They kept tight professional and research links with prominent medical centers and universities, along with continuous collaboration with research labs. Being a firm backer of the Third Reich throughout the war, IG Farben funded many operations tied to the Nazi regime's criminal acts. This included employing forced labor in factories erected near the camps. For instance, at Auschwitz, IG Farben was crucial to the German army's chemical weapons program. It also aided the Nazi campaign to eliminate undesired populations. In terms of medical and drug research initiatives, IG Farben was deeply engaged in experimental programs that used patients. Those patients originated from both the Nazi T4 euthanasia programs and individuals taken from concentration camps without permission. These endeavors involved compensating SS Dr. Helmut Vetter to try out their new drugs on intentionally infected subjects. This took place at Auschwitz and also at Buchenwald, Dachau, and Mauthausen. The subsidiary company Bayer was especially active at Auschwitz. A senior Bayer executive supervised the chemical plant at Auschwitz III, also called Monowitz. The majority of experiments were performed in Birkenau, specifically Block 20, the hospital for the women's camp. Doctors Vetter, Edward Wirths, and Friedrich Entrus tested new medications on prisoners who had been deliberately infected. Hundreds of women from Auschwitz were sold to the biopharmaceutical firm for further undisclosed drug trials. According to correspondence, every known participant in these experiments died while being tested. Those letters were written to ask for additional test subjects. Hitler's government funded yet another set of inhumane experiments for supposed ideological, military, and medical reasons. These were carried out under Heinrich Himmler's direct command to learn about specific wartime conditions encountered by the German Wehrmacht armed forces. The Nazi physicians deemed military necessity as sufficient reason for their atrocious experiments, arguing that the prisoners were already doomed to die. Various types of experiments related to war injuries were conducted at the German concentration camps: Sachsenhausen, Dachau, Natzweiler, Buchenwald, and Nuremberg. Camp inmates were utilized by scientists to test immunization substances and antibodies aimed at preventing and treating contagious illnesses. SS physician Kurt Heisemeyer was keen to attach his name to research that refuted the common notion that tuberculosis was contagious. Additionally, in November 1944, he aimed to create a TB vaccine with help from the camp's leading medical officer. Dr. Alfred Treblinka brought 20 children, 10 girls and 10 boys aged 5 to 12 from Auschwitz to Ningham-Heismeyers. Hundreds of adults and the 20 Jewish children were subjected to experiments. Dr. Heisemeyer cut the children's skin and applied TB bacteria into the cuts, or directly injected living bacteria into their lungs. His goal was to immunize them against TB. He also agonizingly removed lymph nodes from the arms of these Jewish children. Roughly 200 adult victims died as a result of these tests. However, the story of the 20 surviving children did not conclude at the camp in mid-April 1945. As Allied troops approached, Heisemeyer and SS Obersturmführer Arnold Strippel discussed their options, aware that the war was over. On April 20, the children, their 4 adult guardians, and 6 Soviet prisoners were moved to the nearby Bullenhuser Dam School. Since October of the prior year, the Hamburg school had served as a satellite camp. The children were informed they needed typhoid fever shots before proceeding to another camp. Upon reaching the school, the children were offloaded and promptly led to the basement, where they were told to undress by an SS officer. According to reports, he noted that they sat on benches and seemed joyful and content. For once, they had been permitted to leave Neuengamme. The children had no suspicions at all. Instead of getting vaccinated, they faced a different fate. Dr. Tresabinsky then injected the children with morphine using rope sections. Afterward, they were suspended by the neck from hooks on the basement walls. The adults were also hanged from ceiling pipes. However, the SS men struggled to kill the already mutilated children. The first child hung was so underweight from illness and starvation that the rope failed to choke him. SS Untersturmführer Johann Fromm later brazenly described how he then embraced the child tightly. He needed to leverage his full body weight to draw the noose tight. Next, he hung the remaining children in pairs from separate hooks. He recalled they looked like pictures on the wall. He also mentioned that not one of the children cried. From 1941 to 1943, the German military incurred severe losses on the Russian front due to gas gangrene, a bacterial infection causing foul-smelling gas in gangrenous wounds. These losses and other battle-related infections sparked a desire to develop a drug-based cure as an alternative to surgery and amputation. At Ravensbrück, Professor Karl Gebhardt and his aides, Dr. Fritz Fischer and Herta Oberhauser, oversaw experiments starting with tests of new sulfa medications. Ravensbrück held mainly Polish women, those the Nazis considered dissidents and troublemakers during the invasion and occupation of Poland. Without anesthesia, camp prisoners had wounds intentionally created. For both male and female victims, the skin on their bodies and limbs was stripped. Open wounds were then contaminated with bacteria like streptococcus, gas gangrene, and tetanus. Afterward, only a portion of the patients received one of the experimental drugs. When their subjects' wounds did not develop severe infections, they turned to even more horrific methods. The cuts were reopened and packed with soil, sawdust, rusted nails, glass fragments, and other debris. Afterward, the wounds were sewn shut to observe how infections progressed in bone and living tissue. SS Chief Medical Officer Professor Ernst Robert Gehring came to the camp to supervise, noting that the experiment still did not entirely mimic battlefield conditions. Instead, he proposed shooting the women to create more precise battle injuries. To cut off blood flow, Professor Gebhardt and Dr. Fischer clamped the muscle tissue at both ends of the torn wound. Bullet wounds frequently showed this pattern in the damaged tissue. Following these brutal sessions, some women were taken to the gas chambers. While many perished from the experiments, a fortunate few lived to testify at the trials. Beyond infections, techniques for managing bone fractures and grafting were investigated, and prisoners had their legs deliberately broken. Bone segments were not only removed and attempted for transplantation, but muscles and nerves were also excised to study their regeneration. Given that bone grafting was an established technique, much of this amounted to pointless torture. It was part of an even more absurd attempt to evaluate whether severed limbs and joints could be transplanted effectively. At Ravensbrück, doctors amputated legs and shoulders from prisoners and then tried to graft them onto other victims. Although death frequently ensued, every victim endured severe pain, mutilation, and lasting disability. SS Dr. Sigmund Rascher, an officer in the Luftwaffe's medical service, started testing a plant extract as a cancer therapy in 1939. Though advised to use rodents, he demanded human subjects. Himmler agreed, and a human cancer testing station was set up at Dachau 2 years later, in early 1941. Rascher proposed to Himmler that low-pressure, high-altitude experiments be performed on living humans. He aimed to study the effects of high-altitude exposure when German pilots bailed out of their planes, with or without oxygen gear. They were exposed to low atmospheric pressures, with civilian physicians Siegfried Ruff and Hans Romberg from the German Experimental Institute of Aviation present. The experiments took place in spring and summer 1942, using a portable pressure chamber provided by the Luftwaffe. Between 5 and 15 prisoners were sealed inside the chamber. Its internal pressure was then reduced to levels matching extremely high altitudes up to 68,000 feet, 20,000 meters. Rascher made them undergo repeated, gradual, or sudden changes in air pressure, both increases and decreases under low-pressure conditions. The victims grew frantic, pulling out their hair and scratching their faces with their nails. They beat their heads against the wall or screamed until losing consciousness. When pressure was increased, prisoners were seen to experience severe disturbances of awareness. Eventually, their lungs would burst, leading to episodes of agonal breathing, commonly called death throes. Survivors frequently endured severe shock and mental disorders from brain hemorrhages. Even Himmler, after seeing a report on one fatal experiment, commented that if a subject survived such treatment, he should be pardoned to life imprisonment. Dr. Rascher responded that the victims were only Poles and Russians, and he thought they should receive no amnesty. Autopsies were performed on victims, some still alive, to inspect for bubble formation in brain tissue. Afterwards, tissue samples were taken from their brains, necks, lungs, sympathetic nervous system, liver, heart muscles, kidneys, and limb muscles. Most victims perished slowly from their wounds, further tarnishing his record of unethical medical research. In 1942, Dr. Rascher carried out freezing experiments. He wrote to Himmler again, who approved his request, and soon he was plunging prisoners into ice baths. To measure how long and intensely they suffered death throes, these experiments were also carried out at Dachau after the high-altitude tests ended. The aim was to find the most effective method for rewarming German pilots and sailors stranded in the North Sea with severe hypothermia. Dr. Rascher's victims were compelled to stand naked outside in the snow. They endured painful frostbite and biting cold winds for up to 14 hours at a stretch. Alternate them being immersed in an ice water tank for 3-hour periods to ascertain freezing times. While submerged, electrodes tracked their heart rate and core temperature. Intense shaking frequently interfered with measurements and masked abnormal heart rhythms in those who died from cardiac arrest. Various rewarming techniques were subsequently tried on the survivors. Certain subjects were positioned under sun lamps, leading to extensive skin burn injuries. Others received forceful hot water irrigation into their stomach, bladder, and rectum, resulting in agonizing internal blistering of the intestines. Himmler strongly endorsed the trials, even attending several personally. He declared that anyone objecting to Rascher's work was a traitor causing German soldiers' deaths. Referring to a story about North Sea coastal residents, Himmler supposedly noted that a fisherwoman might revive her half-frozen husband by taking him into her bed. He further said that locals thought animal heat produced a different outcome than artificial heat. Acting on this advice, Dr. Rascher asked for 4 Romani women to be transferred from Ravensbrück to Dachau. Hypothermic subjects were then warmed by sandwiching them between 2 naked women, demonstrating utter indifference to their patient's agony. Dr. Rascher apparently asked to move his hypothermia research from Dachau to Auschwitz, citing larger spaces and less disruption from victims. Rascher reportedly lamented that his focus was often broken by the shrieks of hypothermia victims as their limbs froze. A witness later stated that out of about 300 prisoners subjected to freezing experiments, some were thrown into boiling water. Approximately 80 to 90 perished from the experiments, while most others died from camp brutality and deprivation. In 1951, a 3-page post-war deposition surfaced, authored by Heinz Reimer, believed to be among the rare survivors of Rascher's hypothermia studies. Additionally, Reimer recounts viral infections and open wounds inflicted by the DOC, mentioning Dr. Klaus Schilling's malaria experiments. This monstrous Nazi imprisoned me daily for 2 hours in a glass cage. I was forced to bear thousands of Anopheles mosquitoes covering my body. When I could no longer feel the pain, I tried to resist the mosquitoes, thinking my actions would go unnoticed. However, that bestial doctor glimpsed my resistance in a mirror, and for that I was sentenced to 7 days of strict confinement. Before being taken to detention, I was given 25 lashes with an SS bullwhip. Growing ever more driven to produce novel medical research. Seeking fame, Dr. Rascher started testing polygol in early 1944, a substance he invented from beet and apple pectin that promoted blood coagulation. He hypothesized that prophylactic polygol tablets would lessen hemorrhage from gunshot wounds in battle or surgical incisions. Test subjects received a polygol tablet before being shot in the neck or chest. Rascher further evaluated his patented coagulant by monitoring blood droplet flow from freshly severed limbs of conscious, living prisoners at the Dachau crematorium. Naturally, no anesthesia was administered. Whenever additional blood was required for testing, Rascher would shoot his Russian prisoners in the spleen. He authored a paper about his polygol use, deliberately omitting the unethical nature of live human testing. He even established a company to produce the substance, utilizing prisoner labor. Dr. Kurt Blattner succeeded Dr. Rascher as chief physician of human experimentation at Dachau. Blattner also gave the hallucinogen mescaline to Jewish and Russian inmates. This was an element of the Nazi quest for a truth serum to assist interrogations. SS Dr. Wolfram Sievers served as managing director of both the German Institute for Military Scientific Research and the Nazi think tank Ahnenerbe. It funded experimental research at Dachau. Besides the hypothermia and atmospheric pressure experiments in late summer 1944, Nazi doctors at Dachau carried out further tests. These involved compelling prisoners to drink seawater to study its bodily impact. Post-war trials established that Dr. Sievers came to Dachau in July 1944, where he talked with Kurt Plautner and Dr. Wilhelm Wagner, who later conducted the seawater experiments together with Dr. Hans Eppinger. Around 90 German, Czech, and Polish gypsies were the victims, starved and provided solely with brackish yellow seawater for consecutive days. They grew severely dehydrated, to the point of licking freshly mopped floors for any water. The experiments induced intense agony, mouth foaming, and frequently insanity. Additionally, the Nazis performed experiments involving indescribable forms of torture, devoid of any ethical scientific pretense. These encompassed further wound and poison tests, along with documented use of weaponized chemicals on camp inmates. Weaponized chemical experiments started as early as 1939 at Sachsenhausen, initiated by Nazi scientists. Inmates were subjected to mustard gas and phosgene to evaluate potential antidotes. From 1942 onward, SS Dr. August Hirt, director of the French Anatomical Institute at the Reich University of Strasbourg, launched experiments using sulfur mustard at the concentration camp. Survivors of Natzweiler and Nuremberg trial testimonies report that sulfur mustard was applied to dozens of prisoners' upper arms. This caused blistering and agonizing wounds that spread across the body and blinded some inmates. The ointments subsequently tested on victims allegedly induced even more pain. Many prisoners had their blisters and wounds reopened after several days, then deliberately infected by doctors with a mixture of ordinary bacteria to monitor infection progression. These tests inflicted immense agony, gradually destroying subjects' bodies until they died days later. Dr. Hirt's final reports omitted any mention of the experiments on living humans or his victims' suffering. Similar to Dr. Hirt, Otto Bickenbach was a University of Strasbourg professor and a fervent Nazi Party member. Since 1939, he studied possible treatments for phosgene gas effects, a gas used in World War I combat. After reviewing Bickenbach's animal test data for his antidotes, Dr. Wolf from Sievers recommended that Bickenbach proceed with his experiments alongside Hirt's weaponized chemical tests at Natzweiler. Survivor Ferdinand Hull estimated that phosgene gas testing on prisoners started in June 1943. Roughly 90 to 150 prisoners were exposed to phosgene, with 50 to 60 suffocating in violent agony. Further phosgene gas testing took place again in 1944. Among the 40 inmates in these experiments, 12 were compelled to swallow Professor Bickenbach's antidote orally, while 20 received injections. A control group of 8 inmates received no protection. Survivor Willy Helsbach recounted how Bickenbach personally herded prisoners into the gas chamber and smashed fuchsine vials on the floor. Bickenbach and his team then exited the gas chamber, locking the doors. After 10 minutes inside, Helsbach heard a muted splashing from his fellow prisoners' bursting lungs. They collapsed, foam emanating from their mouths, noses, and ears. Helsbach's own breathing grew labored, and he felt as if needles were being thrust into his lungs. He felt a weight on his chest as if hundreds of kilograms were pressing down. He was certain he would not survive. Bickenbach's final report noted that 14 inmates suffered various levels of pulmonary edema, meaning fluid accumulation in the lungs. Prompted by Professor Karl Heiss, additional poison experiments were carried out at Newingham. In the early months of 1945, certain prisoners were compelled to consume water that had been decontaminated after being laced with nitrogen mustard gas. The purpose was to evaluate how well the decontamination techniques worked. After reviewing Haas's results, SS Oberfuhrer Helmut Poppendick concluded that the tests were inadequate. He pressed Himmler to permit Haase to carry out additional experiments, contending that the intake of chemical agents required more thorough investigation. Haase apparently intended to make 8 camp prisoners swallow 8 distinct chemical substances. These were administered in toxic amounts, while a separate group of 8 inmates was given a reduced dosage. The lower dose he deemed safe, aiming to identify the point of overdose. However, in February 1945, Himmler revoked his authorization due to the evolving circumstances. The Allied armies were advancing. Nevertheless, this marked the first instance, according to all reports, where Himmler denied permission for human experimentation within a concentration camp. In late August 1943, SS Commander Joseph Kramer gassed 86 Jewish individuals at Natzweiler Struthof. This was done to assemble a collection of skulls and skeletons intended for the Institute of Anatomy at the Reich University of Strasbourg. The operation was overseen by Dr. August Hirt, with Dr. Wolfram Sievers providing direct aid. According to reports, Dr. Hirt aimed to amass an extensive collection of Jewish skulls and skeletons to establish a museum. The museum would be devoted to the Jewish race, which was believed to be nearing extinction. Documents show that more than 100 Jewish prisoners were initially chosen at Auschwitz. Selected based on perceived stereotypical racial characteristics, only a handful, 872, actually, 9 women and 58 men survived the train transport and forced march to Strasbourg. One of the male prisoners was reportedly shot because he refused to go into the gas chamber. Kramer allegedly stated that he personally shoved the others inside. After being killed, certain bodies were utilized as dissecting specimens for students. Meanwhile, others were cut apart and eventually stored in alcohol-filled vats. The anthropological project that Hirt had planned was never finished because resources were insufficient. Nonetheless, additional specimens continued to be gathered just months before Allied forces arrived at Auschwitz in August 1944. A fresh transport of deportees was pulling in, and Dr. Mengele stood once more on the platform, scanning the newcomers. He noticed 2 people who caught his attention. A father with a hunchback beside his notably tall and good-looking son. The son was roughly 15 or 16 years of age. His right foot was malformed. Dr. Niesli records that Mengele believed he had found something significant. In the hunchback father and his crippled son, Mengele saw a perfect specimen to prove his theory about the degeneracy of the Jewish race. The 2 were promptly dispatched to Dr. Niesli's workspace at crematorium. Number 1. Their SS guard, Obersturmbannführer Mosfet, brought Dr. Niesli a note containing Mengele's orders. Mengele directed that the father and his son be thoroughly measured and examined, after which they were to be killed and examined yet again. Struck by the terrible irony, Dr. Niesli wrote, "As a Jewish physician, I was forced to examine them and later dissect their bodies while they were still warm." He was also deeply disturbed by circumstances he could not change in any way. He felt himself suddenly teetering on the brink of insanity. He stated that it was only by exercising immense willpower that he could perform the examination. He treated them with kindness. He talked with them about their existence in the ghetto and the sacrifice made by the boy's mother. She had starved to death in order to give them extra bits of food. Once the examination was complete, Dr. Niesli provided them with a hot meal, keeping from them the fact that it was their final one. About 30 minutes later, Oberst chauffeur Musfeld came back and guided them to the furnace room to get undressed. 2 gunshots from the Oberst Scharführer's revolver were heard by Dr. Niesli. The autopsy performed by Dr. Niesli on the father and son would reveal no evidence to confirm Mengele's hypotheses. Niesli stated with bitterness that their corpses could still serve as material for Nazi propaganda. An additional 10,000 of the newly arrived men and women were dispatched to the gas chambers to be killed. Dr. Mengele came to the crematorium to hear Dr. Niesli's account regarding the father and son. Determined to avoid cremation of the bodies, Mengele inquired of Dr. Niesli which techniques could be employed to conserve the skeletons.